Hey y'all, so it is International Nystagmus Awareness Day. Did you even know we had a day? Yup, we got 2 days in the same month. We got Albinism Awareness Day and Nystagmus Awareness Day. So I'm going to talk to you now about Nystagmus Awareness Day. So are you ready? Let's go. Nystagmus is basically rapid involuntary movement of the eyes. Rapid involuntary movement of the eyes, meaning that it happens when and where, however it pleases, and it's not something that we can control. So next, there are 2 types of nystagmus. Did you know that? 2, congenital and acquired. But for the sake of this video, we're only going to talk about congenital nystagmus because that is what people with albinism have. And congenital just means that you're born with the eye condition. Acquired means that you develop it later on in life, and typically it's brought on due to head traumas, heart attacks, strokes, alcohol use, drug use, things like that. That's where acquired nystagmus comes in. But when you have congenital nystagmus, such as, again, those of us who have albinism, it's something that you're born with, and studies say that it shows between 6 to 3 months of age. So how does one get nystagmus, specifically congenital nystagmus? Because we just discussed how you can get acquired nystagmus. But when it comes down to congenital nystagmus, yes, you're born with it, but it's got to be more to it. Got to be more meat on the bone than that, right? Yeah. So basically, it's brought about because we don't have melanin. Remember, albinism is brought about due to little to no melanin being present in the hair, skin, and eyes of the affected individuals. So because we lack melanin, that means that our brain is unable to process that portion of our brain that controls our eyesight and eye movements and imaging and processing. It's not working. It's not doing what it's supposed to do. It's not giving what it's supposed to give. So because of that, our brain is left to try to make it work. The little bit that it has, it's trying to make it work. It's trying to help us see a picture. It's trying to help us put this thing together and, see something. So because it really can, and it's not really working with too much of anything, we're left with our eyes shaking. That's the whole reason why they're shaking, because our brain is having trouble trying to process what is before it, who is before it, what is before it. It's trying to process it, it's trying to put it together. So that's why some of the symptoms that come along with nystagmus is shaky or blurry vision, dizziness. Sometimes our balance is off, or if you're sitting still, have you ever noticed that your head sometimes is tilting back and forth? That's your brain. That's our brain. It's trying to put together this piece of the pie. It's trying to put this puzzle together. It's trying to give us the image or the picture so that we can understand what we're looking at or what we are seeing. So that's how you get it when it comes to congenital nystagmus. So y'all, there is no cure for congenital nystagmus, but if you have acquired nystagmus, there are ways that they are able to be cured from having it. Because again, you have to remember, acquired nystagmus is normally acquired through head traumas or heart attacks, strokes, drug use, alcohol use, things like that. If they work on those things with their doctors, then they are eventually able to not have nystagmus anymore. But when you have congenital nystagmus, which means you are literally born with it, and in our case, due to the fact that we have albinism, there's no cure. The only thing that we can do is work with our eye doctors and receive treatments that will help aid us in navigating through life with it a little bit better. And in treatments, I'm talking corrective lenses like contacts, eyeglasses, eye surgery, things like that. They won't necessarily cure it, but they'll help us navigate through life with it a little bit better. It won't be as difficult to get through with it when you are working with your eye doctor and, using the treatments that they suggest that you use. So again, for those who have acquired nystagmus, the answer is yes. Eventually, over time, they are able to be cured from having that type of nystagmus. But when you have congenital nystagmus, there's no cure. So y'all, I hope that you learned some more and that you grew some more in your knowledge of albinism, and not just your knowledge, but your understanding on it. And I really want you to know that it's nothing wrong with you having nystagmus. We went through all of that, but the purpose in doing this is just to let you know that you're fine. I'm fine. We're good. There's nothing wrong with you having nystagmus. There's nothing wrong with me having nystagmus. We're not worried about a cure. We're not worried about the symptoms. We're not worried about that. Why? Why are we not worried? Because you and I, me and you, we were born this way on purpose for a purpose. And that is to do great things with little to no melanin in our hair, skin, and eyes. So no matter the eye conditions that come along with having albinism, no matter the looks, no matter the stares, no matter the comments, we're good. So You don't have to worry about being ashamed. You don't have to walk around embarrassed anymore. Listen, been there, done that. When I was a teenager, when I was growing up with albinism, I would intentionally, when I was talking to people, look down to the ground, look off to the side. I didn't want to have any eye contact with people because I didn't want to get any questions or comments. I didn't want to deal with that. So I would just not look at people when they would be talking to me. I just wouldn't do it because I was just that affected by having nystagmus. I hated it just that much. And yeah, I went through understanding what it was with my eye doctor and my parents, but I didn't like the effects of it because in my mind, well, if it's nothing wrong with having nystagmus, then why does everybody treat me the way that they treat me? Why do they make the comments that they make? Why this? Why that? You know, so because I couldn't understand or even accept the answers to those questions, I just refused to have anything to do with it. So I just would not look at people. And it was anybody. I'm not even saying that the people or the person that I was talking to was going to say anything negative. I was just so used to that being the norm for me that I didn't even give people an opportunity to not be what other people were to me. I didn't do it. And so now, in this space that I'm in, I have to catch myself from doing that or continuing to do that because I made it so second nature. It was so habitual for me when I was younger. So now it's like I have to untrain myself from doing that when I talk to people because I held my head down because I was ashamed, because I was embarrassed, because, you know, I was so broken behind my experiences with albinism, my experiences with dealing with nystagmus and things like that. So I've been there, I've done that. I understand the shame and the overall ugliness behind what people can do and say to you when you are the way that we are. But I also understand the healing and the wholeness that comes from God in his truth, which is what I just said to you a moment ago. We were born this way on purpose for a purpose. So there's nothing wrong with you. You have no reason to walk around like I did and hold your head down when you're talking to people or look off to the side. Have confidence and look straight forward, because when you know who you are and whose you are, you don't have any time to walk around and, be embarrassed. Be you, be beautiful. Don't run away from public speaking. I used to do that. I ran away from it because I was so embarrassed by my eyes shaking. So I didn't want to have a room full of people looking at me with my eyes shaking. But now you can't keep me out of a camera from talking. You can't keep me from standing before people trying to run my mouth and tell them something. You can't stop me from doing it, because when that shame broke, when God broke that stronghold over me, I've been a blabbermouth ever since. And I can't, me and this camera, we find each other too often we find each other. So it's just something that you grow into, and the process is not something that's easy, but eventually you grow into it. And we're normalizing it. We're normalizing nystagmus because it is normal for us, and there's nothing wrong with us. So again, I hope that you enjoyed this video, and that you learned a lot more than you knew prior to watching this video about nystagmus. And I really, really, really pray more than anything that you feel a lot better about having it. And if you don't right now, you will eventually later, because again, it's a process. And if I got through it, I know you can too. So again, you and I, me and you, we were born this way on purpose for a purpose, and that is to do great things with little to no melanin in our hair, skin, and eyes. So happy International Nystagmus Awareness Day. Woo!